Hello everybody, welcome back to Medical Monday.
Welcome back. We're very excited you're here.
Yes, this week we're going to be talking about the knee, but very specifically a portion within the knee called the meniscus. And this is what separates the top bone and the bottom bone and is very costly as a part of knee care itself. This meniscus tear is one of the main reasons why we have loss of work. We looked at knee before where we had about a $40 billion cost of care. This injury right here, the biggest cost of care is lost time because of the pain.
Wow. Lost time because of the pain in the knee from something you can do pretty simply in regards to how this injury happened.
The stories of some of these injuries are almost comical. But why do these injuries occur?
Because of weakness and typically some type of jarring or twisting movement in the knee. It happens quite common in athletes that involve sudden stops and goes. So if you're stopping, jarring to change directions, and then going, it will catch.
Soccer, basketball really comes to mind.
Yep.
Tennis. Pickleball is a big one.
Yes.
We have a large pickleball community
Yes.
up in April Sound area. And those patients are not moving as much as regular tennis, but even that slight stop and go motion can cause that twisting in there and damage this meniscus. But it's damaged for a reason. When we look at the anatomy of a knee, it is encapsulated with all these muscles and tendons because we're putting great force upon the lower part of our leg to get this movement. Well, when we do that stopping motion, you can see the difference in the top part of the bone and the bottom part, this little cushion right here. That's where it sits on, just a little cushion. Remember, all those muscles and tendons, strong muscles and tendons, a little bitty cushion here, all right? That great force can cause a twist and get this little cushion to tear, unfortunately, quite easily at times.
It is very, very, very easy to tear. So it's really just making sure you do the right thing at the right moment to get it done.
Yep.
But we don't want you to do that.
No. It's always about prevention.
Correct.
But we have a couple of different specific tears. Now, when we go through the different areas of how those two bones come together, there's very specific tears and motions that it goes through. And, hopefully we get some of the smaller ones, then not the bigger ones. Those are the ones that are very debilitating, that there's really not, one of the things we always talk about is how you have an injury at home. What do you do to help yourself first? Yeah. Those are the ones up top. The ones on the bottom, unfortunately, those are much more complex.
Correct.
There's not a lot of home therapies that you can do for those. But the simple ones are very treatable at home. And those typical things that we do at home look like what?
Yeah, absolutely. So just like what we talk about, what you guys hear, just about every week, ice. Icing is crazy important to help control the amount of inflammation. Inflammation is how the body heals itself, as we talk about quite often in this show. And so it's very important to make sure that through that inflammatory process, it's a healthy amount, not an unhealthy amount. Chronic inflammation can cause issues. So icing is crazy important to help reduce the inflammation and allow the body to properly heal and recover to, really get those great results.
And it feels good too.
Oh, it feels so good. At first you're a little, but then once you
This guy has ice directly on his leg. Now, for you at home, ice is very cold, so always wrap it in a towel so it doesn't have direct contact on your skin.
Yes, absolutely. Well, then also what happens is
this is a tough guy, though. I think he's
very
fine.
Tough.
I might need 2 towels.
We did mention soccer, so I can only imagine that he's a pro athlete. And we talked about having the injury, taking care of things at home. You still have to live life. You still have to do things. So
kids don't go away when you have this injury, right?
Unfortunately, even when you're sleep deprived, they don't go away. Yeah. But we still love our kids. So modify. It's so important to modify what you're doing to make sure that you can still get through that work day. Make sure you can still get through that day-to-day. That's so important to make sure you can achieve what you need to achieve and do what you need to do. And you know what? One of the number one things that brings patients into the office, Lonnie, is something that they miss doing that brought them joy.
Oh, yeah. A loss of lifestyle or change within lifestyle. It's one of the biggest concerns. Patients come and say, well, my knee hurts. Okay, but why did you come to see me? It's not because your knee hurts. It's
correct.
Now you can't play pickleball, or now you can't enjoy tennis with your husband, or you can't pick up the grandkids. That's really why they're here. This pain in the knee is is more of a symptom of this lifestyle change that we want to help them modify to get back to doing those activities.
Yeah, and sometimes modifying what you love doing is what it takes. And then also exercise. Through reducing the amount of inflammation in the knee, through modifying what you can do and cannot do, it's very important to make sure you continue to strengthen and use that knee. So make sure that you find some great exercises to strengthen your knee joint through this injury, or even support your friend to make sure that they have great exercises to do. Google's a great option, and I like to really encourage, we all have some great common sense, so make sure that it's not, too outlandish when we talk about using YouTube for exercises.
Hardcore parkour, yeah.
Hardcore parkour.
Not good for a meniscus tear.
Correct. We just want to make sure we get some settled, modified exercises to keep.
You've tried to modify a few things. You want to do some exercises, you want to do some ice, you want to do those things to bring you that comfort level, but it's just not working for you. So you seek out some professional help. First things first is they're going to recommend a very high-end brace. Now, this is not a normal brace that you would get from Academy that's just going to provide some support in there. This brace is going to stabilize the knee so it no longer twists at all, so it doesn't make that tear any worse. This really just kind of supports the knee as it goes through that healing process.
Correct.
But this is not your average, not a compression sleeve. It's not something you're going to find, on TV or something.
No.
It's a very complex brace to stop that movement.
Yeah. Typically, they're described as medical grade, so that you can't get them over the counter because they're very specifically designed to prevent those.
And they can hurt your knee if they're not put on and fit properly. So that's why it needs to be done with a professional. This professional has helped go through some stretches and exercises. Just because you have a meniscus tear, which is only that small portion in between your knees, doesn't mean the rest of your knee doesn't also need rehab and function. Because it allowed for a twist in the first place, which is not good. So those tissues also need to be worked on so they can strengthen up as that tear heals.
Yes, very, very true. And then also, sometimes the pain is just so significant through that recovery process that a type of steroid injection or different types of gels can exist to help through that process. It's typically a phase or a temporary type fix. This is not something that should be done over and over and over again in hopes to fix it. This is actually to help reduce the pain so you can rehab. Reduce the pain so you can get back to what you need to do and continue to live your life. What we don't want these type of injections to do is allow you to get back on the field and cause that tear to go from the top row of tears we talked about to the bottom row of tears.
Minor tear needs to stay that way. It should not progress to a major tear. And any modification, whatever it is that now allows us to do more, can jeopardize that, and it can make it very dangerous into a major tear.
Yep, absolutely. So we've gone over quite a bit, the knee joint itself, what is the meniscus, the different types of tears, what you can do at home, and then when you reach that point of maximal help at home, other professional options that exist. But there's also, everybody's waiting to know what we can do here.
You just wanted to know. Here you go.
Know.
You ready for it?
Absolutely.
What we do here is
Yes.
knee decompression. Knee decompression is phenomenal because it straps the top part of the leg and the bottom part and gently pulls. Now what that does, it puts tension and pressure on the joint space to exchange the nutrients, the fluid that's really within there. With that exchange of the fluid, it becomes a very healthy environment, not a... over time, it can be like a stagnant fluid that's not very healthy. You want it to be as healthy as possible, the fluid, so that it can heal whatever damage, whether it's a meniscus or other problems within there. This really helps with that. And this also helps stretch and strengthen the ligaments that hold the knee together so that, once again, they allowed it to happen, so they need to be tightened up so they don't allow this to happen again.
Yeah. This is so phenomenal therapy because you mentioned the stagnancy of that joint space. Not so much because we don't use the knee joint, but what this allows to do is truly pump that fluid and get a lot of great nutrients in there. You know what else is important? When you're modifying how you're walking from an injury on your knee, you're actually going to affect your hip joint, you're going to affect your low back. So for the sake of structure and mechanics, it's so important to make sure everything is properly aligned and functioning. So there are different types of techniques that exist for, regarding chiropractic and adjusting to make sure the knee joint itself is aligned, that hip joint is supported. Sometimes the ankle can get irritated, but also that low back and mid back to make sure structurally everything is starting to mechanically work.
Really hits home on the old song as a child. Your knee bone's connected to your thigh bone. Yep.
You said thigh and I said hip. That's funny.
Well, I'm from Texas. You're from Louisiana.
That's true.
Whose version is right? I don't know. We'll have to Google afterwards.
Neither one.
But, beyond that, we make sure it functions properly, but we also want to make sure it heals properly. And this is where we get into some of the advanced regenerative medicines. This is this platelet-rich plasma. Now, this is the patient's own blood. Concentrate those growth factors down and place right within that tear. There's no blood flow within the knee. Unfortunately, it's encapsulated. So you don't have your own growth factors flowing through there like you would with a normal, a muscle tear or just a skin cut that you would have. So what can we do to help get that into the joint space? Just draw it out, concentrate it down, and then we inject it right back into that spot where the tear is at so we can start the healing process much faster.
And I want to say it's very important to take care of injuries like this in the forefront of them, because injuries like a meniscus tear can actually turn into things like osteoarthritis.
Yep.
So it's crazy important to make sure, even if it's an old injury, to have it looked at now to see, is a PRP injection right? Do I need to strengthen my legs? Can I help myself in some way to prevent it from actually getting worse in the future? So the PRP is a great way to do that, but also making sure strength changes happen as well. So, wow.
Hope you learned a lot about meniscus tear.
This was a fun one, I feel like.
Very small in between the two bones, but it's very, very painful for patients.
Yes, meniscuses are no fun. So, but that is our Medical Monday this week. Thank you so much for joining. Make sure you share. You have neighbors, you have a friend, anybody that has knee pain of different types, but still today was about meniscus tears. And we'll see you next week.